Prince George's County has the most cases. It's nearing 5,500. And Prince George's County Executive Angela Alsobrooks is joining us live on the phone this morning. Angela, thank you so much for joining us.
Oh, thank you so much for having me this morning. Good morning.
Yes, good morning to you as well. First question, I mean, there could be a surge in cases, of course. We all know that. But the question is, how are you guys preparing for that right now?
So, we've been preparing over the last several weeks, including a hospital surge preparation that culminated in the reopening of Laurel Hospital along with the governor. I reopened 3 floors of Laurel Hospital. We've also done quite a bit to make sure that we have our frontline support prepared, including EMS and some cross-training that happened between the police department. For example, if we find an occasion where we don't have enough EMTs to drive the ambulance, we have prepared public safety so that we might be able to put in a sheriff or police officer to drive that ambulance. We've also been working with the governor and the state of Maryland to make sure that we had enough hospital beds at many of our facilities, including ICU pods, because we've seen that, unfortunately, many of our patients are very sick with COVID. So we needed not as much med-surg beds, but ICU beds. So we've established ICU pods at 2 of our hospitals. We've also been able to have some tents out in front of our hospitals so that we can see some of our patients and screen them. And we also stood up the site at the FedEx field starting March 30th to make sure that we could test and screen individuals who did not have insurance, and this was critically important to us to make sure that every segment of our community could be covered. And so starting March 30th, we were able to test nearly 1,000 people at that site, and we have now transitioned that site per our plan to the Cheverly location, where we will now see individuals 5 days a week, Monday through Friday, 9 to 4:30 p.m. And so we've been able to really expand the testing that we've been able to do as well. And so we have really put together a plan that included making sure that our patients, even those who did not have insurance, could be screened and treated if necessary, and that we could care for our sickest patients.
So, funny story. I had 2 more questions, but you kind of just answered all 2 of those.
Oh, I'm sorry. Yes.
No, we love it. We love it. But I do have another question. Last week, we did see massive lines of people in the area waiting in line for free food. Now, what steps are you guys taking to make sure that no one goes hungry?
Oh, my gosh. We have established several partnerships, including the World Central Kitchen, which has been fabulous and provided tens of thousands of meals to our residents across the county. We have daily food deliveries at Ebenezer AME Church, the Sanctuary, the Community of Hope. The county is also partnered with the Capital Area Food Bank to provide food for our residents who have been in need. And this food bank now has a 90-day plan to make sure that we're serving the needs of all of our residents throughout the region, but most especially in Prince George's County. And I'm proud that we have been able to raise more than $1.2 million to go to this food bank earmarked only for Prince George's County. That includes a $500,000 donation from the counties of the funding, as well as Bank of America and Dan Snyder. So we're working to address the food insecurity issue, which just, I'm telling you, upset us so much. We wanted to make sure that nobody here had to go without food during this time, and so we'll continue to provide that.
Well, Angela, thank you so much for joining us this morning. Prince George's County Executive Angela Alsobrooks. Thank you so much.